Hello all, and welcome to the Caregiver Support Series. A quick reminder before I jump into our topic of the week, don't forget to call and make your advanced care planning appointment. We had some very productive conversations last week. So guys, this topic is something I feel especially passionate about. A fear of opioids is a major barrier to quality symptom management at the end of life. I'm talking about opioids such as morphine. As a hospice nurse, I have seen opioids give people some of their quality of life back without giving them the side effects that can sound so concerning. This is your host, Sarah, and today I will be talking about the use of opioids specifically for the treatment of shortness of breath. Grab your favorite hot beverage and sit back. As always, feel free to reach out with any questions or concerns. My words to describe segment is focusing on opioids. Really quick intro. Have you heard of the Brompton cocktail? It was created in the 1890s by Dr. Herbert Snow and was considered a traditional, safe, and effective elixir for pain relief for almost 100 years. It was given to patients just coming out of major surgery and to those with terminal illnesses. It provided good pain control and promoted sociability, even in the last days of life. It was created by medical staff like a physician, and sometimes they had their own custom formulations. They could tailor the elixir to each patient based on the symptoms that patient was dealing with. The most common or standard formulation consisted of an opioid, mostly morphine and or heroin, a stimulant, usually cocaine. This helped with sociability and gave the patient some energy while combating the sedative side effects that can happen in the first 48 to 72 hours of taking an opioid. And the final element was alcohol. The patient could choose their favorite liquor, such as vodka or whiskey. This gave them a sense of control over their pain management plan and helped with the bitter taste. Other possible ingredients included anti-nausea meds, antihistamines to help people sleep or with itching, and other stimulants to give people energy. In 1979, Canada put out a study that showed that this concoction, this multi-drug, expensive elixir of relief, really had no additional advantages when compared to getting a single dose of an opioid by itself, and there were less side effects. This was the end of the Brompton cocktail. My point in sharing this is that pain management is ever evolving, and we need to believe the science. The Education Corner will touch on addiction, and I have some resources for you to check out at the end of the episode. Next week's episode is going to be a little more fun. I will introduce you to some easy, quick activities that are thought-provoking and focus on your well-being. As always, my sources are cited in red. An opioid is a substance that binds to opioid receptors in the brain to block pain signals. A natural opioid is made from the poppy plant, and a synthetic opioid is made in a laboratory. Opioids treat moderate to severe pain and shortness of breath. Off-label uses include cough suppression and to ease severe diarrhea. There are short-acting versions that start acting in as little as 10 minutes and last up to 4 hours. And there are long-acting versions that can last 8 to 12 hours. Opioids are prescription only, and there is no max dose. Opioids can be taken many different ways. Through the mouth in the form of a pill, liquid, dissolved tab, or suckers. Through a skin patch, in the form of a suppository, or in the form of a shot, like through an IV into a muscle, or through an epidural or an implanted pain pump. Opioids are significantly better than oxygen in reducing shortness of breath in terminally ill patients. They decrease the feeling of breathlessness in the brain, dilate blood vessels, which decrease blood pressure, lowers oxygen consumption, lowers the heart rate, and slows down the breathing. I know these things sound scary, but people who are having true pain and or shortness of breath are experiencing a high heart rate, they're breathing really fast, and their blood pressure is climbing. They are usually very, very anxious as well. Taking an opioid decreases the sensation of pain and the feeling of shortness of breath. Opioids also have an anti-anxiety property. That's why they work so well. The most common side effect is constipation. When taken as prescribed, opioids can provide much relief for terminally ill patients experiencing pain and/or shortness of breath. When abused, or when someone takes too much too often, they can lead to a devastating addiction. I'm not downplaying the disease. Addiction is very serious, but addiction is bigger than just opioids. Addiction is, of course, a very devastating disease, but it is also, and unfortunately, very misunderstood. In order to understand addiction, I find it is best to compare it to tolerance and dependence. The first thing to note is that tolerance, dependence, and addiction all can result from the repeated use of a substance. The major difference is that tolerance and dependence are characterized by physical effects, and addiction is characterized by a person's behaviors. Tolerance happens when the body adapts to the substance, so the relieving effects are lessened over time, which means that a higher dose is needed to achieve effective relief. Dependence is a condition in which the body has become so used to the presence of the substance that the body goes through withdrawal without that substance. Dependence is predictable and measurable. Withdrawal symptoms are expected if the substance is rapidly decreased in the bloodstream, stopped abruptly, or an antidote such as Narcan is administered. Addiction is a primary disease resulting from using a substance, such as medications or alcohol, repeatedly. Someone who is addicted has an uncontrollable or overwhelming need to use their substance of choice. An addict has particular behaviors. They crave the substance and they are impulsive. They will continue to use the substance despite documented harm. It is as if they are no longer in charge of their own decisions. The bottom line is that a person can be physically dependent on a substance or have a high tolerance to it without being addicted. About 8 to 12% of people who are prescribed opioids for chronic pain end up with an opioid abuse disorder. There are genetic, psychosocial, and environmental factors that influence a person's risk of becoming addicted. Addiction itself is a primary chronic neurobiological disease. Also, opioids are certainly not the only substance that people become addicted to. Consider this sentence for a minute, because it's one of my biggest pet peeves. Morphine kills people. There is no convincing scientific evidence that administering opioids using established guidelines, even in very high doses, accelerates death. Numerous clinical studies demonstrate no significant association among opioid use, respiratory depression, or shortened survival. Respiratory depression and other changes in breathing are part of the dying process and can more likely result from the terminal disease and multi-organ system failure than from appropriately dosed opioids. Fine, I will concede that morphine has the potential to kill people. If used irresponsibly, it can certainly cause death, but so can other substances. If someone takes too much Tylenol, they can go into liver failure and die. In fact, I have cared for people in the ICU who attempted to take their life by taking too much Tylenol. Insulin, another drug that if taken more than prescribed, could result in death. What about alcohol? Just think about it. So nurse tips. If you are prescribed an opioid for short-term pain management, number 1, do not panic. Educate yourself, ask questions, seek resources, and take as prescribed by your physician. The only other true tip I have is to have a stool softener on hand, even if you don't think you'll need it. As a great admission nurse in hospice likes to say, if you do need it, you can take it at night and have a letter in the mailbox in the morning. If you or someone you know is struggling with addiction, please check out these resources. Thanks for watching. This has been an episode of the Caregiver Support Series brought to you by Hospice of Northwest Ohio. Next week, I'll give you some easy activities that are thought-provoking and introspective.